¿Qué cambia cuando estás deprimido? Es que te sientes completamente anulado como persona. No sirves. No sirves. Es como un dolor profundo. Hasta que un día dices, ahí va, estoy más animada, pero sí, creo que hasta me he curado. Sí, hoy, mira, hoy estoy feliz, hoy canto, hoy bailo, hoy pum. Y esta energía de la cual hace un tiempo estabas tú en la cama que no te podías ni mover, para mí era una explosión. Y aquí estamos ya hablando de un brote maníaco.
My name is Eduard Vieta, I'm professor of psychiatry at the University of Barcelona, and I'm also the head of the Department of Psychiatry and Psychology at the University Hospital, and I've been one of the leaders of the emerging field of precision psychiatry. The way we diagnose bipolar disorder currently is based on symptoms and what is reported by the patient, and this clearly causes some difficulties in terms of variability, in terms of reliability of the diagnosis. We've made some studies looking into how long it takes to get the right diagnosis of bipolar disorder. On average, most countries find between 4 and 11 years, which is really bad because many of the bad things that happen in this condition take place at the early stages. We really need an early diagnosis and an early intervention.
No tener diagnóstico es como estar en un pozo muy oscuro, porque sabes que no estás bien, pero no sabes lo que te pasa. Y hasta que no me dieron el diagnóstico, no pude pensar en cómo ir recuperándome.
The process can be quite tricky and difficult, and it's been calculated that for 1 year delay in diagnosis, the cost for society is around 50,000 euros.
Para mí, un diagnóstico más temprano hubiera significado todo, porque me hubiera ahorrado una etapa muy dura y muy difícil de mi vida.
My name is Alexandra Prieux. I am CEO of ALCEDIAG. We set our mission to advance precision medicine in psychiatry. And really, what the heart of our work was to find the biomarkers not within the brain, because we cannot access it, but within the blood. EDIT-B is a blood test. It's an aid to diagnosis for psychiatrists to differentiate unipolar depression from bipolar disorder. What we bring is objective biological data. So we complement all the elements that the psychiatrists already have, and the objective is to have a quicker and better diagnostics.
La diferencia principal de ser diagnosticada en un análisis de sangre es que te ahorras estar en un pozo X meses. Cuanto antes te den la noticia, podrás empezar a ordenar tu vida. Y eso es primordial para una persona que está enferma.
It takes a village to raise a kid. I think it also takes an ecosystem to take an innovation to the market. We could not do that on our own. EIT Health supported financially our project and made us benefit from its amazing network by introducing us to a number of our partners today. The psychiatrists, regulatory experts, the clinical laboratories. We are a research laboratory, so we really needed to make a connection with a large-scale clinical lab who had that kind of industrial experience.
My name is Maurizio Ferrari. I am the Chief Medical Officer of SYNLAB Italy. SYNLAB is an international company that is present in 4 different continents. Is working in the medical fields, mainly in laboratory medicine and medical activities. It's very easy for SYNLAB to outline in all the different European countries the very strong power of this test.
I met ALCEDIAG in an EIT Health event. They had already some data available. We decided to go for a replication and then to ask for funding and do a large multi-site international trial.
The process starting for taking blood and send the sample to laboratory where we do the RNA sequencing. Then we upload the data to ALCEDIAG and then receive back the data. We prepare the report and we send the report to the psychiatrist that evaluate the importance of the results for the patient. The process takes about 4 weeks. For sure, it's very short in comparison to the time that usually is needed to make a diagnosis for bipolar patients.
SYNLAB is really a powerful partner because they have a nice footprint in Europe and outside of Europe. They're present in more than 20 European countries. So by working with this one partner, we can cover a very large part of Europe. And in the end, we were able to commercialize 2 years in advance thanks to the network.
We've been recruiting a lot of patients already. It's always a great thing to be together working on a common objective, which is to improve the life of our patients.
It's not always easy if you want to do something that is meaningful. You always have difficulties. You have difficulties in the research space, in the commercialization space, in the regulatory space. So it's really bringing an innovation to the market is a long and difficult journey. EIT Health has a vision for innovation and was willing to help us in developing an innovation in mental health.
EDIT-B will transform lives of patients with earlier diagnosis, better treatments, tailored treatments, less side effects.
Tengo muchas esperanzas para el futuro. Este nuevo análisis puede ir directo al grano y diagnosticar realmente lo que se tiene.
Es muy importante que sepa cuanto antes a qué se atiene y qué tiene que seguir y hacer para que su vida pueda ser más o menos normal. Bueno, pues a poder llevar una vida digna y tranquila.